The MIT economist who said the stupidity of the American voter allowed Obamacare to pass testified on Capitol Hill Tuesday. He apologized for his remarks, calling them glib, mean, and insulting. He also insisted that he wasn't qualified to remark on the political process since he's not a political expert. And joining us now with reaction to the hearing is Michael Dougherty, a healthcare business owner from Atlanta. He's also the author of The Devil Inside the Beltway, which exposes his victimization by a cybersecurity company with links to federal agencies. Mr. Dougherty, what was your take on the hearings this morning and Gruber's response?
Well, you can't get the genie back in the bottle once it's out. And not only is he not a political expert, he's not a medical expert either, and that's the point. So, you know, he misspoke a million times. Actually, he just said the truth. Now he's trying to spin it backwards because that's what they're trying to do. To me, he looked, people call it lawyered up. I think he was crisis management up, but it doesn't change what happened.
I'm just curious, you're saying he's not a medical expert, but he's considered the architect of Obamacare.
That's the heart of the problem. When you have politicians with power practicing medicine, this is what we have. This is, I'm sure, just the tip of the iceberg. I mean, all this does is confirm what we knew, which is that people that don't have medical backgrounds are messing with this. They're really exploiting the health of the country for their own political gain and their own power. And I'm sure there's more stories like this that went on. He's just he's one of the more reckless with keeping things secret. You know, Pelosi said, "Oh, we just haven't read it." Well, they read it all right. They're just not going to say what's in it. And he just let it slip several times.
At this point, what concerns do you have with the Affordable Care Act, where it stands right now?
I have the same concerns I had before he spoke, which is we have non-medical people ripping the infrastructure of medicine. They don't know what they don't know. So where they say they're trying to help people without health care, they're compromising the health care of everyone, including those people that don't have it. They have harmed lots of people. They have used spin and punditry, and what we're about to see is the reality. And there's nothing they can do about that. They got a taste of it in November, and there's still a lot more of Obamacare that's been implemented. And I'm very concerned for the long-term health of our medical system. Once you burn a house down, you can't build it back as quickly. And the faster this turns around, the better.
And how is Obamacare affecting your company at this point in time?
Well, everyone in medicine is having to be involved in much more bureaucracy, having less control day to day, much more procedural. I think different aspects of medicine have different effects. The more complex your disease state, the more severe the impact. If you just have lumps and bumps and sniffles, you know, that's one thing. But to have expensive cancer tests or molecular tests or long-term type care, that's where all this shaking of how things are done really hurts you as a patient.
All right, Mr. Dougherty, thanks so much for your time and your insights.
Thank you.